Today on Insight, we're here with Dr. Ron Cohen at Cohen Orthodontics, and we're going to talk about multidisciplinary dental treatments.
Perfect.
Huh? Could you explain that one to me?
In dentistry, there are a number of us that have different specialties that we look for. My job is to move teeth around and look at the relationship that it has with the jaw structure and the jaw joints. We have periodontists whose specialty is making sure that gum tissues are healthy. General dentists that are responsible for restoring people that have missing or malformed teeth, endodontists who do root canals. Multidisciplinary really means nothing more than forming a team that can give the patient that needs a lot of special care, not just to run the mill, move a couple teeth or a crown here or there, but that have situations where they really need to have a lot of things done and coordinated so that they get the best possible result.
And you guys do that here at Cohen Orthodontics?
Yes, we work quite extensively with our group of dentists and other referrals that we work with. And the cool thing is that with all the technology we have, it makes it very easy for us to make our plans together so that we all know where we're going to end up even actually before we start. The more we can communicate, the better result our patient usually gets.
Well, I would think it makes it easier for the patient because they don't have to be going to this person and then relaying what that person said to the next dentist and relaying what that dentist said to you. It just would make it simpler all the way around.
Oh, exactly, and with the technology now, a lot of the times we'll have our discussions using GoToMeeting. We'll have three of us on the phone, and we can look at the same computer screen and say, okay, this is where we are, this is where we want to go, what works here. The pictures that you guys will get a chance to see that I'm going to provide will show you a case that goes start to finish of someone who was missing a number of front teeth, never liked to smile, was a salesperson, and so was always out in the public. And when we got him finished up with the moving his teeth around and then having the implants done and having the crowns and everything put on, the first words were, "I can't believe how much I love the smile now."
Yeah.
So we can change people's lives by being able to put together a really great multidisciplinary team.
Well, and that makes all the difference. I mean, that makes somebody so much more confident when you're... So, as part of the multidisciplinary team, I'm getting really good at saying that, where does the orthodontist fit into that? What's your part in that team?
The way that we kind of look at least that I look at it, is that the general dentist is really our quarterback. That's the one that has to say, okay, I've got a patient that is missing these teeth and we need to make this bridge or put these implants in. I need the teeth next to them to be in the proper position. I need roots to be lined up where they're supposed to be. I need to make sure that the gums are where they're supposed to be. So working along with the quarterback, you know, I'm one of the wide receivers. So
I love football terms because I totally can picture it now.
There you go. Yeah. Well, I go out for the pass and I line the teeth up as I'm running along, and making sure that I put everything right where they need to be, so that when the surgeon does the implant or the periodontist does the implant, it's where it's supposed to be, so that then when the dentist does the crown, it looks like it belongs where it's supposed to be also. So it's a series of cascading events that we all really have to follow the directions of our general dentist. Many times we'll kind of go back and forth, and one guy will say, well, I want to do this, and the other guy will say, well, I can't do this, can we do it this way? So a lot of times there's a lot of give and take to make sure that we get to the best possible position.
What a great thing for the patients. Not only is the communication already there, but also they're getting the expert in each of those fields.
Sure.
So that, you don't have somebody who occasionally does that, but you're getting the expert in each of those fields. Is it a new idea in dentistry and orthodontics, or have you been doing this for a while?
I've been doing this for a while. The newness is really the ability to make the communication so much easier and so much more exacting. There are a lot of things that you can compromise. Somebody's missing a couple teeth and they compromise their bridge or compromise their implants. But long term, since a person's going to have this for 40 or 50 years, it takes a little bit more from an investment standpoint because you got more work to get to that point. But long term, you're going to have a lot longer lasting restoration and something that you're going to be a lot more proud of from a cosmetic standpoint and functional standpoint if you're willing to invest up front to get it done. There's some people that say, nope, just do the best you can with what you got, and for that, multidisciplinary treatment's not necessary. But those of us that would like to have something that lasts long term, the better teamwork that you get, the better chance you have you're going to get the best result.
I'm just saying, if I have something done, I don't want to have it done again in another year.
That's right, exactly.
Let's make it last for a while.
Exactly.
So if somebody has what they feel like are some extensive problems and they know they need help, what's their first step?
Usually their first step is with their general dentist. Depending upon, if there's trauma involved, sometimes the surgeon's involved first. Sometimes they'll come to me because they have a couple teeth in front that are crossed over. They don't like the way they look. And then you look at the back teeth and everything's all falling apart. And you got to go, well, wait a minute, there's other stuff that we have to do here. Usually the general dentist is the one that initiates this, but it can come from any of the team.
All right. Well, just one more way that Cohen Orthodontics is kind of on the leading edge here of technology and doing what's best for you in your situation. You're going to want to visit them today. Give them a call. Dr. Cohen is in Churubusco and in Fort Wayne, or you can visit their website, docronsmiles.com.